that as we are now in classes and we're teaching classes, you know, the back issues are a whole lot more common to walk in with than tinnitus or any of those other things that, you know, certainly you're going to have some knowledge of, but not as much. Yep. So I think that's where we're going to start today. Let's just take a little minute and honor our teachers. Good. So, I'm going to read you a little email I just got yesterday, 2 days ago. Audrey, thanks for getting back to me with options for times. I'll review my issues in a nutshell and discuss more when we meet. I have spondylolisthesis, spinal stenosis, and osteoporosis. I'm 63 years old and have been active most of my life and in good health. Now she's coming. I've been recommended to do a strong exercise program with focus on core strengthening. Hopefully she doesn't come to your class. That's all I can say. That's a pretty big load of stuff to have in one person, right? And so I thought that what we would do is look at some of these very common conditions and break them down a little bit, and then at the very end we'll talk about what might work for this particular lady, which is not going to be a general class. So that's kind of nice for you. Okay. So, and if you notice the thing I wrote, so a guy walks into a yoga class with back pain. Let's start there. And then we're going to go to the stuff. And I might jump around a little bit because that's just the nature of this. Okay. So the main thing, okay, somebody comes in and they're brand new. Do you have any issue? And I kind of want you to use this language. That's why I wrote it down. Do you have any issues or conditions I need to be aware of? Back, neck, shoulders. Let's ask them if they have diabetes, because sometimes they might have forgotten to eat or something like that. And I gave you a sheet on the warning signs for diabetes or blood pressure. And hopefully they might let you know. Often they might not. So if the person says, yes, I've been having some back pain and I heard yoga might be good for my back, or they say, or they say, I'm having some pain in my lower back right now. All the black things they could possibly say. I have a protruding, bulging, herniated disc. I'm having pain in my buttocks. I have piriformis pain. I'm not sure what's causing the pain. All of those things. As soon as you hear that, you know that your class is going to be about that person. It doesn't matter what you've planned. Your class is now about that person. Because that's what I wrote down here. Doesn't mean you're not going to meet other people's needs, but number one is we don't want this person to walk out with more pain than when they walked in, and we want them to hopefully have less. But certainly if we don't consider them primarily, we could hurt them. So, say you were thinking you would do lots of arms up over the head. Well, people with back pain are lots of arms up over the head right now, probably not a good idea. So then we'll talk about like the kinds of things you should do when they have those things later. But I want to talk about some of the back conditions right now. And we will use the sheet that says, in injuries and conditions, spine. This is the one that looks like this, the one that's not quite finished. So you might need, it's not the one in Darcy's packet, it's the one I brought today. There are 3 pages, front and back of page 1. And then the back, and so Darcy, I'll send this to you, not quite finished with it. And if you could also pull out the one where it says examples of disc problems. So that goes examples of disc problems, herniated discs. There's 2 pages on that, 3 pages on that. We'll start there. Isn't this fun? Everybody's really quiet.
No, there's not very many of us here.
I know, I'm sorry.
Right, did you say symptoms of degenerative disc?
Examples of disc problems, yeah. Is there something that says symptoms of degenerative disc?
Yes.
Could be. Yeah, okay, we'll take that too. I don't have that page for some reason. Maybe I do.
Do you need it?
Yeah, I have one. Oh, there you go. Yay, cool.
Examples
Oh, there it is. Got a picture of a spine on it.
Sorry, I was printing these out all night and I just didn't have time to.
Yeah, oh no.
Oh, the effects of aging on your spine too, here it is, yeah, effects of aging on your spine and symptoms of degenerative disc disease, those two go together. Let's start with that, the effects of aging on your spine.
And degenerative disc disease.
You see the picture there on the upper left?
Which
And there's
page?
also examples of disc problems, that's a good one to go with this, kinda. So, are we good to talk about this, yeah? Okay. So let's just be clear that, I mean, you've all been in lots of classes, and there are more classes that have people with no back issues, or very minimal back issues, than classes with people who have profound back issues, yes? So don't panic. It definitely means that we want to understand this and we want to be careful with it. Like I said, in the injuries and conditions, this one we're on the spine, you have to look at when it says don't, when in doubt, leave it out, and do. If somebody shows up with a herniated disc to a Yoga 2 class, if they show up and they have some back pain in a Yoga 2 class and you say, well, you know, have you had any diagnostics? No, my back's just tight, I've been sitting at work, you know. So, okay, so go carefully, you know, don't do anything that doesn't feel good. Let me know if there's a problem, don't push yourself. And maybe if it persists, you want to see a medical professional, right? And it's always good to come to Yoga 1, you know, and go a little bit easier. But if somebody shows up at a Yoga 2 and above class and they have a herniated disc or they have one of these bigger back problems, you really want to strongly encourage them to come to Yoga 1 or Ultra Gentle, or if they're not really sure because it's pretty big, then they should call me or email me. And if they have a currently herniated disc in an acute situation, I would suggest that you say, I would really feel safer if you didn't take this class, if it's a Yoga 2 class and above. I mean, if it's something that had a long time ago and it's okay now, like what other, did your doctor say it's okay for you to do this? What other exercises do you do? Oh, I surf, I do this, I do that. Well, you know, they're able, I mean, people do this, you know, I have this, but I'm doing all that, so they're probably going to be okay. However, you still say, come to Yoga 1 and learn the fundamentals. You can be here today, be very safe, but come to Yoga 1 and learn the fundamentals. We have a sort of school policy that requests that people with back issues learn the fundamentals because we want you to be safe. And you can always talk it over with your doctor. Does that make sense, that kind of thing? Yeah. So let's just say that almost everybody has degenerative disc disease at some point, in the sense that the discs are fluid, they're going to lose fluid. They're not going to imbibe as well. They're not going to take in as much interstitial fluid and be as spongy and pillowy as they were when you were young. But a lot of people will come in and say, oh, my doctor said I have degenerative disc disease. And, you know, often it's just that they haven't been moving much and they have muscular tension. And yes, they have degenerated discs just like you and I do. I mean, I don't. No, I mean, my discs aren't as plump as they used to be. So you know, then the question is, how much pain do you have? Do you have any sharp shooting pain? Did your doctor tell you not to do certain things, right? And so then I'll usually say everything we do today is, especially if we're talking about Yoga 1 or Ultra Gentle, is going to be very back friendly. But there is a chance that if you move the wrong way, you might tweak something. So really pay attention, go easy. We'll give you some feedback. And if the person truly has degenerated discs, as you look down, you see some real thinned discs at the bottom, and you see some osteophytes, right? Osteophytes are bone spurs. Then what's the main thing you want to do? If somebody has something like this.
Core strengthening and teaching them to use the hips.
Right, exactly. core strengthening and back lengthening with hinging at hips. So good posture, learning neutral spine, and core strengthening and back lengthening. So if you think about it in overall strategy, as opposed to don't do this pose or don't do that pose, think about what the overall strategy is. And I'll tell you, that kind of pretty much applies to all back conditions, right? And we will go to some very specifics, but the simple thing is people with back conditions still have to bend forward for the most part. So we definitely have to teach them how to hinge at their hips. We definitely want to teach them how to strengthen the core. And I would suggest that I was going to make a sheet on back safe core strengthening exercises, and I will still probably do that because some core exercises are better than others for back strengthening and for back safety. If I can get there by the end of the day, I will. And we still have to be careful, like if someone has a bulging posterior lumbar disc and we're teaching them to do pelvic tilt and use core strength and they're shoving that back down into the floor, that's probably not so good either. So we do have to take that into account. So for degenerative discs, meaning that the discs are, you know, maybe not protecting the nerves as well as they would have if they were plump, let's look at that on our sheet here. On the injuries and conditions, right? Don't compress discs in spinal hyperextension. That means a back bend, right? So could they do crescent pose? Kind of depends. If it's a great big crescent pose with a lot of back bend, no. If they really are in pain or they've had a big problem, no. Is something like this maybe okay? Yeah, sure. You know, crescent pose on a chair. So I'm quite certain, Alice, in Ultra Gentle, you have lots of people with degenerated discs, and you still do some crescent pose with them, right? What was I going to say? One of the most important things we can teach people with all of these disc issues is correct posture. Right, so we should even put that in as the main thing, like spinal lengthening, hinging at hips, core strengthening, and good posture, which means that we don't slide the hips forward. We don't tuck the butt, we don't slide the thighs forward, and if you can get that, that's half the battle. So don't compress discs in spinal hyperextension or flexion or rotation beyond safe limits. So we're not going to ask them to do Kormasana or something like that where they're really, really flexing the spine. We're not going to, like, what would you say a safe limit, what changes rotation from a safe limit to something that you don't want to get into? That's one big thing.
Locking down the hips.
Locking down the hips is good, yes, and leverage, right? So we're not going to do something like this or like this in any kind of thing where rotation is a problem. So no leverage, right? But revolved high lunge is leverage, right? You're using one hand and your hand on your thigh. So could people with degenerated discs do revolved high lunge? Not somebody in Ultra Gentle. But could somebody who's 70 years old at the you don't go to the cancer class yet, Alice, I'd like you to. I have 70-year-olds at my cancer class who probably have degenerated discs, and they do revolved high lunge. But they have been at it for 10 years. So, you know, it kind of just depends is the answer on that. What is a person's overall fitness level and where are they at? So if they tell you that they have degenerated discs, then you kind of want to ask them a few more questions. Like, what are the other kinds of things you do? Start at the beginning and see how it is. What did your doctor tell you? That's another good question. If somebody says I definitely have degenerated lower lumbar discs, I would immediately stay out of Shalabhasana, Cobra, Up Dog, Bridge. Bridge meaning lockdown bridge. Bridge meaning, what's it called? Setubandha. Setubandha, sorry. Yes, Setubandha. Don't do Setubandha, but you could possibly do rolling bridge. Just depends. Again, how capable are they? How much space is there? You gotta.
Could you do artist Shalavasan and told them not to use their arm?
Yeah, Don and I had this discussion yesterday. So you could possibly, again, you could possibly do either this, leg off the floor, or this, head on the floor, but as soon as you lift the head, you drive force into here. So it could be head on the floor, squeeze between the shoulder blades, leg off the floor, but you can't start compressing this. You could put a blanket too underneath the hips to make a little more space here, but then you get into teeter-tottering, so you have to watch that a little bit. I mean, the rule of thumb is if somebody has a doctor that tells them you have degenerative discs, be very careful at yoga, you're probably not going to do a lot of spinal hyperextension. Spinal extension is fine. That's this. This is spinal extension, right? Spinal hyperextension is anything that moves the front body open and compresses the back body. A little bit of crescent pose is probably, why is that the safer thing than Shalabhasana?
I would think Shalavasan is safer because they're on their belly and they don't risk, like, I consider crescent to be kind of a difficult pose.
Well, you're
Because of the
thinking of
balance.
crescent coming up from the floor. I'm talking about crescent with your hands on a chair.
Oh, hands on a chair.
You're always standing up straight.
Yeah.
Because the floor is a levering agent.
Yeah.
You're levering with the floor. Crescent pose done very simply, you know, one hand on a chair, you know,
You can keep yours.
yeah, you retain your core,
Yeah.
you're not going to step back very far, you're not going to get very much. I mean, 10 degrees of step back is plenty for that, you know, maybe a little bit more. Yeah. So, again, and it goes to teaching. You know, you have people who have back issues, you don't just throw them into crescent pose. You go, let's talk about that. So you start with the 13 inches, you start with coming up and down on your toes, so you feel that. And then coming up and down on your toes is a real good prep for crescent pose because it teaches you how to maintain this, and then you can use that in your crescent pose, yeah? I put no excessive crescent or leverage twisting poses. So what's good for creating space in the back? Wink your pony gently. So if you're going to teach wink your pony, you know people have back issues. You don't just step them back and start cranking on it. First, you teach them how to step back, just bend the knees and pull the hips back. And you breathe with that for a little bit. And then if the person has a back issue, everybody else goes ahead and winks their pony, and you walk over and you support them so they don't hang and they don't crank. And you say, let's just do this a little bit at a time. Is it okay if I touch you? Let's just do this a little bit at a time. And that would be important because they could crank it pretty hard, right? And also in a revolved triangle, same thing. Revolved triangle can be good with back issues, but sometimes we put people up very high, which is good because then they're not in flexion. But then they do this, right? So, you know, when you go to those poses, make sure you're kind of right there and you watch them to make sure that they stay relatively 13 inches in that rotation. Let's see. Down dog on the floor, down dog on the chair. Again, you know, these are all like Alice isn't going to put down dog on the floor in her ultra gentle group. I also really like, you know, the hanging machine that I have there. You can do that by strapping the hips a little bit in downward facing dog, not with your group. This is not going to work for ultra gentle, but just in general for people, using a strap around the hips in downward facing dog creates a little bit of traction in the back. Core strengthening without too much weight on the lower back. So, meaning that if I'm going to do core strengthening with these people, doing something like this would be good as long as I'm not pushing too hard. Now, for some people, this would be too much. For others, it would be great. For anybody with a back problem, this is a no-go. Does that make sense? Anything where there's two legs pulling on the pelvis, no-go. But this could be just fine. However, we had a student who had a back problem. She has some degenerative discs, and that was too much for her. It caused her pain afterwards. So,
What about twisting the floor like that?
twists on the floor like that? Yeah, so if you're going to do a twist here, it's going to be only at the hip, yeah? maybe they have a strap here if they can't reach it, and it'll go to about 45 degrees, right? They're and you're gonna have to watch and make sure that leg doesn't fall out and they're not doing this. But generally, if they have back pain, they're not going to do that anyway. But this is actually kind of a nice practice, yeah? And especially for degenerated discs, that one isn't gonna bother the discs too much.
Would another core strengthener be with, is it too much with both knees up and one leg going down and touching and come back up?
Way too much.
So having both legs up, or feet off the floor.
Yes,
You don't want
right, exactly, exactly. Really, the best one is that one that I just showed you. Because they're gonna use their core and they're gonna be fine. And then maybe a little lift up for the upper transverse abdominis if they don't have degenerative discs in their neck. Any kind of neck degenerative discs, and we'll get to head and neck a little bit. You don't want to be lifting the head off and pulling on the head because you can hurt them, right? Also, a really good one for back, core strengthening for back health, and like I said, I'll make a list of this, is this one, right? So just lifting the belly and then taking one leg away. I mean, we did this, right? Three-legged table, it's a great one. You know, you really can't go wrong, but don't do it this way, right? That's a problem. So two-legged table, usually three-legged table is just fine, and you just really do it breathfully and attentively. Kind of good, yeah? Now, if somebody has a disc bulge, they will give them that at PT, but they'll stand there and watch them the whole time. So you kind of, you know, if you have someone with a disc bulge, I wouldn't do that in a group class. I would say, maybe we stay after. Have you done this in PT? How did that go? That kind of thing. But I wouldn't do that in a group class because it's too easy for them to squish their disc, unless they know how to do it already. All right. So let's look at the kind of disc problems you can have. So there's the example of disc problems. It says, what is degenerative disc disease? Examples of disc problems. Do you see that?
Not the symptoms of degenerative disc.
There's the one right after that one.
Do you mean just the picture?
The picture?
Is that the one
Yeah,
you're looking?
just the
Just
picture.
the picture one.
Examples of disc problems?
Yeah.
Okay.
And see, the thing, what is this, on that thing where it does say symptoms of degenerative disc disease? More pain when sitting for a long time, less pain when you're walking or running, less pain if you change position frequently, less pain when you lie down. That's why yoga is good for people with degenerative disc disease. It's not like they walk in, you're thinking, oh, maybe they shouldn't be here. They're in exactly the right place. That's what you want, because you want to get those back muscles that create the compression stretched out. And everything we do in yoga stretches the back muscles, so we're good. Okay, so we see what a bulging disc is, yeah? Discs can bulge many ways, obviously. The most common bulging disc is a disc that goes to the side and out the back, like Mr. here. Mr. Boney Jr., see that one? It's toward the back, it's not right in the front surface, and it's to the side. And that's the most common, and the most common way that's achieved is through this, right? So now I'm tight, for whatever reason, I pick something up, and now I have a side bulge. So in our Yoga 1 classes and Alice, in your Ultra Gentle class, for sure, you want to spend time teaching, picking up correctly, turning, placing things correctly, putting your groceries away. I just keep that in my classes as kind of a running thing that I do. When I have enough new people, I do a lifting class or a carrying class to make sure that they really understand that. And then I think on the next page it shows the variations in, in herniated discs, because you should know the difference, right? Like a bulging disc is not a herniated disc. A bulging disc can just push over a little bit to the side and the nucleus can kind of be intact. But when the disc herniates, then the nucleus kind of gets leaky through the annulus. Can you see that on page 2 of 3, if you go over 3 pages?
With a bulging disc, does that typically just heal itself with time?
It depends where it is, and it depends on what the person does, right? So if the person continues to exacerbate the problem, like they're a horseback rider, and they keep riding and they don't do what they need to do to go to physical therapy and take care of it and get off the horse, they can make it worse. For sure. Well, yeah, possibly, yeah, could be. I think it's on page 2 of 3. Says, oh, I've been sitting in my chair. That's different. We know how to handle it. It's somebody who doesn't know how to handle it. So then, if there's any back pain, then we hinge, we bend like this, we use the chair, and we just support the torso. Now I can do all that stuff, preferably if I have a major back issue with the chair or with cylinders, but I'll be supported. So that's where, sorry.
Sorry, I was just thinking, what about spider, since it's fine?
Yeah, spider's good, same thing, same thing.
Because your back is flat and your arms.
Right,
your arms are
right.
down.
Anything that supports the weight of the torso in neutral spine will probably be okay. And up higher is better, unless higher means that the person arches their back. Like that lady that the other day, who might be here today. Tall, so she's doing revolve triangle, she's arching her back. She might have gone a little lower on the chair and been a little safer in general. So, so that's where Iyengar yoga is good for back issues, because everything's supported with props. Vini yoga, the moving in and out, the turning, all of that, not so good for people with back issues. Doesn't mean they can never do them ever, but not while they're hurting. Does that make sense? Because you want support. You want the back to be able to stay stable, work around it, and go from there. You can also have spondylolisthesis where one vertebra protrudes over the other in the thoracic spine. That's kind of not common, but I've certainly seen that many, many times. And so now as this goes this way, it'll either protrude the disc this way or it'll shove this way and the disc will come anterior. So the same thing applies, is that if I have a disc problem here, what don't I want to do?
You don't want to twist too much.
I don't want to twist too much, exactly. I don't want to wrench it, but I can turn. I just have to know not to do this. Yeah, what else?
Cat stretch?
Yeah, cat stretch standing you can do, you just don't do it big. So I just do like this and like that, right? And maybe I don't the first day, somebody's brand new, they say they have that, then I'm not going to do it then because I don't want them to mess it up. But any kind of excessive thoracic rounding, could somebody who has that do this? Tabletop and back, it'd be good for them. You know, it still stretches their back muscles. They're just not going to press it up really, really high. Does that make sense? And similarly, they're not going to come up here and be rolling over it, right? So, but they could pick their hips up, probably. You just have to see how that feels. Does that feel okay? It depends where it is, if it's lower or if it's higher. That could be okay, yeah? Could they do downward facing dog? Not if they're in ultra gentle, but they could do downward facing dog on a chair, probably. Could they do plank? Possibly. I mean, again, not if they're 70 or 80. But could they do plank in a regular class if they have that? Sure. Yeah? All right, so let's see. Cervical spondylolisthesis, cervical bulging discs. What don't, poor Mr. Bulging, this he didn't have any.
I know.
And they lost an arm, I know, he's in a sad way. They lost his arm? My sister. Yeah, medical research. What don't we want to do if somebody has bulging discs in there? Or degenerate discs? Have them look up without support. If they support the back of the head and they go like this, it's fine. I mean, unless it causes them pain. If it causes them pain, then don't do it. But in fact, it's good for them to stretch the throat as long as they don't lean back too far. What else can't they do?
A lot of arms up.
You know, maybe one arm up. It just depends. Again, you know, You get somebody like Jim, the guy who has the neck issues, and he does everything. He's pushing it a little hard. But, you know, I have a person who's going to be coming to your class. This is as far as she can turn her head. So, you know, the nice thing about neck, when you have fusions and things like that, where they literally fuse the vertebra together, they put a cage in here, they wire it together, is you can't move your head. So you're not going to ask them, you're just going to say, you know, relax your shoulders, move your head wherever it will move. You're not going to ask them to lift the head up. You're not going to ask them to push the head down, for sure. And it's not going to go down anyway, most likely. Is it okay for them to do this to tolerance? Yeah, absolutely. They're just going to go where they can go. What should people who have neck issues do? Yeah.
Yeah.
Mobilize the shoulders safely, because you've got to know that if this is all locked up, all that tension is going to be sitting right in here. So all this stuff, everything that you do with shoulders, again now, you got to watch that their arm isn't too high, right? As soon as their arm gets too high, then we get it in the neck. But anything you can do to mobilize the shoulders, and you just say, if you have pain with this, then please let me know. Really, really good. Another thing that you can't do when you have neck issues is you've got to watch hands on blocks. So say I have a neck issue and I'm like this, I'm looking up to see the teacher, not so good. And even just being here for a long period of time with a person with a neck issue can be really, really tiring. So you have to just say, it's really okay. Sometimes I'll even say, it's okay to put one hand on your back because it just relaxes a little bit, or to let the head come down wherever it's comfortable. They don't have to hold it up. Usually just letting the head come down will be good. Similarly, if they're in triangle pose and they've got a neck issue and that's bothering them, a lot of them, you'd say, well, look down. A lot of them can't look down. So then you just don't stay in this long. Then you come out. Take the arm out. Maybe the arm is up for a little bit, but take the arm out and then don't stay as long. If they're laying on their bellies, they cannot lift their head up. It's not a good idea. If they have a neck issue. Jim, you know, he can sometimes, you know, if the person has neck issues but they are good at what they're doing, they can lift the head up by lifting the spine, and the neck can support that. For a lot of people, that would be a no-go. And then also, for a lot of people, doing anything like this is very uncomfortable for their neck. So they don't do that at all. They just do the core strengthening this way. And if you're working on this, you can have them, while everybody else is doing the lift-ups, you can say, breathe in here, exhale, pull the belly down, and really squeeze here, right? So they really focus on this. Could somebody with a neck issue do this instead? Maybe, but what would I need to do? Probably.
Put the head on the head. Support the neck. Down.
Then that arches your back.
Does it?
Yeah. Put a blanket under the head. So now the head is lifted, they're comfortable, and they can do that. Yeah? So that would probably be okay. All right, let's see. So we'll get to sciatic stuff and sacral stuff in a little bit. Let's go back to our sheet, if you don't mind. Thanks. One thing I put, which is kind of general, but always, don't diagnose if someone has pain. Oh, it sounds like you might have an L4, L5 bulge. Don't say that. Just say, have you had, as soon as somebody has it, have you had any diagnostics? What have you learned? I also did put in there, if they do say they have a disc bulge or herniation, then you should treat it, or they might worry if they have a disc bulge, and treat it as if they do. In other words, don't take a chance. Don't go, oh, maybe it's just, you know, muscular tension. So be careful. And when they say they have a bulge, ask where it is in the spine. If it's to the back, the front, the side, or the back side, and ask which side, if it's the left side. Because, for example, say they have a back left bulge, and now you're doing palm tree, and you're taking them to the left, and you're squishing it. That's not so good. Or if you're taking them this way and you're protruding it more, not so good. So kind of good to know when they're rotating, you know, you want to be careful that they don't over-rotate into it. So just good to know which side. Avoid hyperextension or lateral flexion or rotation to affected side. So if to front, which is less often, you don't get a anterior bulge, very often avoid spinal flexion, right? So a lot of really deep cat stretch. Be a little bit careful in child's pose, try to keep the back long rather than flexed. Don't compress discs in spinal hyperextension, flexion, or rotation beyond safe limits, depending on severity of condition. For those who have currently diagnosed lumbar disc issues, which doesn't mean, we have lots of people who have had lumbar disc issues in the past, and they are doing Shalabhasana and Cobra, but it all goes to, you know, where they are in the rest of their practice, how old they are, how they feel. So certainly that's not where you're going to start. No Shalabhasana, no Cobra, no Up Dog, no Sphinx, which just kills me because I went on these two world famous PTs and they're going, oh, you got a lumbar spine issue, do like this. Just hang out here for a little while. If you can't hang out, this hurts too much, okay, well just go like this. But then pretty soon, go up like this, and then do like this. And I'm like, and they're just putting this on the internet, and anybody could do that without anybody watching them. It's kind of, I think it's irresponsible, really. So I'm not saying that could not work within supervised PT and with the right person who all other factors are exactly right. In other words, you're trying to squeeze that disc back in, but that's definitely not our job. We're not going to try. We can't monitor them, so none of that would be good. And you're always, if somebody says they think they have a herniated disc, always recommend they go and get it checked out. Get a diagnosis so you know what you're dealing with. Small crescent, if belly line causes pain, you could put a blanket underneath the hips, but if they say it doesn't feel good, your best bet is not to do it. Small crescent with good form and core support may be okay with back lengthening directly after. Like when, what's his name, Andy and Lori come. Andy has the back issue. Now he can do a little bit of crescent pose even though he's had recently herniated discs. He's been in PT. His PT lets him come, knows what he's doing. And so like a little crescent for him with a chair, not, he's in Yoga 1. So, a little crescent like this is okay for him now. But he's been in yoga for a while. If I have somebody brand new who has a disc issue, I'm certainly not going to do crescent, and that would be important to Alice. So if somebody walks in and they're currently hurting, I would stay out of the back bend entirely for that until you get to know them a little bit and see what their overall fitness is. Yeah.
Audrey, what about like Prasarita Padottanasana? Oh,
Yeah. Great. Yeah.
that's
We
all
should
good.
put that in too. No.
Okay.
Yeah, because you don't know that that's not going to hurt their back, right? So I would just have them do spider, and then just stay with hands on chair for now, and then say, does your PT allow you forward flexion of the spine? And generally the answer is no.
Yeah.
So just a nice hinge, like when Tony was here. Remember Tony? And he would have his hands on the chair and stay there. Yeah? It's not optimal, but they can just put their head down and then you just don't stay there so long. It's a great question. Don't overdo back flattening because the lumbar muscles could be so tight that you could pop the disc out more. So once the body is warmed up, if somebody comes in with a disc issue, I really don't mind doing this just a little bit because the back is supported so the disc isn't going to push out more, right? It can't, it's on the floor. But if I do this, now I have space and now I can push the disc out more. So I love this because it allows the back muscles to lengthen, but asking them to really do that right off the bat, these back muscles are probably kind of short, and so we're just going to cause pain and strain, right? Because we're going to irritate them.
So like when you practice breathing on the floor, you
Right.
would do that with them.
Would not? Is that what you said?
Yeah, you would not, like how you bring your legs in for
I would.
You
I
would?
would very gently, one leg at a time, once they're already warm, and I'll have that in the what to do when your back is, when you go to back. Those classes where the guy walks in with back pain. I'll bring that in, yeah, because I like that a lot. Only one leg at a time, and then maybe you let them hold the knees and very gently circle, depending on how bad it is when they walk in. Similarly, if somebody is kind of like this and they're kind of shortened in their mid-back, and if you overwork this too quickly, it's you're insisting that they get those bottom ribs down. That can cause pain because they just moved. They've been in this shortened position quite a long time. Better to start stretching side. Wink your pony, side stretch. That's why that side stretch is so good. The only thing you've got to remember when you're doing side stretch for people with back issues, don't let them get excited and do this, right? Oh, this feels so good. You have to keep them over their legs. So their weight's in their heels, but this is as best you can. I'd almost rather them kind of angle forward from a hinge than arch their backs, right? Because side stretching really good because it creates space for all the muscles to stretch out. Let's see. And you're just going to have to read all this stuff. Cervical disc issues, keep neck as neutral as possible and as spacious as possible. Avoid head lifting and forward bending with hands on blocks. We said that. Don't stay in an arms forward position like hamstring stretch too long. We said that. Shalabhasana, no good for neck issues, especially with arm coming forward, unless the person has a strong upper back and can carry neck neutrally. And, it was a long time ago. And that's why I put unlikely. No head lifting and core strengthening. I think I said all this. All right. No looking up at hands in sun salutations, right? If they have a neck issue, look straight ahead. Certainly no camel, nothing like that. Because we do have people like Stacy who, can do a yoga 4 practice, but she has a neck issue. So, she's not going to do head back. That's not going to be so good for her, yeah? What to do for disc issues. Make sure that you're doing everything with knees bent. So, hinging at the hips, winking your pony, downward facing dog, nothing that's going to pop the spine, right? Can they be use of props for support, so up high enough that their back stays long? You're just going to keep what's important in mind. I got to keep space for these discs. No cantilevering with an unsupported back. Can they do, can a person with a disc issue do Warrior 2? Probably. If they're really heavy set, I might think again because they're probably going to put all their weight in there. So I probably would not do that then. But if it's a relatively, athletic type person, they can do Warrior 2. That's where hip shifting is really good. Because instead of you just saying, okay, go over here, put your hand on the block, and they have no idea, by shifting the hips, they're doing essentially neutral spine to the side. Does that make sense? And then if they do have a disc issue, you don't have them put their hand on their thigh or inside their thigh or no hands. You put the hand on the chair or on the chair on the block. So they have support, yeah? And then I wouldn't, if I have a person with a disc issue, go back and forth. I would try to make it very static, right? We're doing Warrior 2 to both sides. Now we're doing side angle pose to both sides. And if, say, they have a left side posterior herniation, I probably would just have them come right up on their fingertips, or maybe not even. Maybe they do Warrior 2 and they just bring the arm up. I don't know. Kind of depends. Kind of depends if they can shift their hips. It could be okay. You know what I'm saying, Anthony? Yeah. Could they do triangle pose? It gets a little trickier. Yeah, I probably would leave that out. If they just have degenerative disc disease, yeah, they could do triangle pose. But if they have a herniation, I'd probably leave it out. Yeah?
So, can I clarify, when you said mini yoga with a herniated disc, you leave it out?
Absolutely.
But if they have a bulging disc or back issues, possibly you can do it if they have high enough props or a chair?
But not video.
But not big.
Hamstring stretch. No, nothing where there's unsupported, I call it cantilevering, you know what a cantilever is, right? Unsupported hinging, where the torso is coming forward enough to put stress on back. Like this, I think I'm kind of thinking this is kind of okay, you know? Unless it's really pinchy here, unless they have a massive left side bulge, maybe I just have them go here and I have them do this, right, on this side. That might be enough, right? Because going to chair might be a little bit too pinchy, especially if they don't know what they're doing. But I could have them do something like this. Because we're just thinking like how much are they gonna go? The first day they're there, I certainly would not, right? But Warrior 2 could be okay. Does this all make sense to you? I know I'm zooming through it, but it is kind of like, there's not much more I can say except what I'm saying. So, looking at their posture faults is really important. Thoracic disc issues. So gentle chest opening is really good because if they've been in pain, they're probably doing this. Neck stretching is very good. But you got to watch out if they have thoracic problems for doing anything like this, right? So too much compression, too much squeezing is not going to be good, right? So that's when you're going to get into all your clock face, all your arm forward, all your chest stretching that leaves the spine alone but works on. You could do W's. W's are good because they're not going to push the chest forward too much. And just the rule of thumb in any kind of injury is you want to stretch it before you try to strengthen it. It's not like you want to go directly, oh boy, we got to start strengthening your upper back where their chest is really, really tight. Ball rolling really good, but they have to be a little bit careful around the area that bothers them. Cervical issues, upper back mobility, movie groovy, chest opening without head back, upper back strengthening without strain on neck. If the person says they have a very old disc issue, ask them what they've been able to do since the initial issue and what their doctor recommends. Oh yeah, I had an L4, L5 lumbar protrusion 6 years ago. Well, but what have you been doing since then? Well, I run, I hike, I ski. They're probably pretty okay, right? And you can say, well, so it'll still be important for you to strengthen your core and to really learn good posture and neutral spine. Because there's always going to be a weakness there, right? So we want to make sure we take care of that, especially when they don't really know what they're doing. Okay, so then I'm just going to look at spondylolysis and spondylolisthesis. Often people will tell you they have spondy, so that's what that is. Just so you know. No cantilevering, hips over legs. Vinyasa sun salutations is considered a cantilever, right? Because you're, hinging over the hips. No spinal hyperextension, even belly line, maybe too much without a blanket or hips, no crescent past 10 degrees. Shalabhasana, Cobra, Sphinx, no Mackenzie maneuver. Bridge lifting, I don't mind, even with lumbar issues, just a pelvic tilt and lift off if it feels safe for them and they feel like they're not tightening and flexing because it strengthens the hamstrings and the glutes. So I'm okay with that, and that's pretty common in physical therapy. So pull the belly in, lift the hips up. Don't do a massive pelvic tilt, but contract the pelvic floor, belly in, hips up. But I wouldn't do that their first class, right? I'm talking about down the road. The first class, you're going to go as safe as possible and go more to strength, or more to stretch and length.
Audrey, what exactly is this condition, spondylosis?
That's the one where the vertebral bodies go over one another,
Okay.
like that, right?
The
Spondylolisthesis, yeah. So spondylolisthesis is when there's a little crack or a break in it because they've had such force and it hasn't gone over. Spondylolisthesis is when it's actually moved over like that, but it's treated exactly the same. You do exactly the same thing. Let's see. And we talked about all of those things to do for that. So you'll have to read these things and go from there. Bone spurs. Bone spurs are really tricky, and I didn't. This was just when I had to leave to come here. Bone spurs are tricky, and people can have bone spurs and not know it. And so if they have pain that continues, oh, my back hurts, I would just say, go get an x-ray. Let's take a look and see what's going on. These bone spurs can develop for so many reasons, like overuse of the back in a certain area is really, really common. You know, the way the bone is trying to build there because it's trying to support some kind of weakness. And those can really get on nerves. If they impinge a nerve, it can be excruciatingly painful. So if somebody says I have a bone spur in my back, you know, usually often it's up here. I have a bone spur here in my thoracic spine. What should you do? Don't tighten it. You know, make as much space as you can. Don't tighten it. If I have a bone spur, I mean, for me it's different. I do this, but you know, somebody tells you you have that bone spur right there. You're not going to have them do this. You're not going to have them do that, right? If they have bone spurs in their lower back, you know, then they have to just do length and stretching and hinging at the hips, and you know, you see how it is, because that's pretty common stuff in the lumbar spine too. So doesn't mean you can't do yoga. It just means you just have to kind of work with the PT and see what the PT has to say about extension of the spine and all of that stuff. Osteoarthritis. I'm going down and then I'll go back. Osteoarthritis is what? You know?
When the cushioning starts to degenerate everywhere, in your joints.
In your joints, yeah. So it's a degradation of the joint, right? Usually the cartilage kind of wears away, or the bone starts to get degraded, and it can be rough, it can be ragged, and a lot of us have osteoarthritis in our spine just because we've been carrying around these hulking bodies for a long time. So it's not uncommon to have arthritis in your spine, and really the prescription is the same. You know, hinge at the hips, don't overstress the back, don't do something that is a level 3 practice if you have osteoarthritis and you're just coming to yoga. You'll have, I'm sure almost everybody in the ultra gentle has arthritis in their spine a little bit. So you just go gently, right? And you don't, the big thing is no force, no leverage. You really don't want to crank, no cranking, right? Rheumatoid arthritis is an inflammatory disease. So you'll see like fingers that are kind of like that, joints that are like that, toes that are twisted. And usually when people come, they come to Ultra Gentle. Do you have anybody with rheumatoid arthritis right now? No, not too bad. And sometimes you don't even notice it when they're in the hands. They'll just do what they can. You're just going to do an Ultra Gentle practice. We have somebody that comes to Yoga 1 who has rheumatoid arthritis, beginnings of it. It's Meryl, just in case you see her. She's a morning person. She's young. She's my age. She's on medication for it. The medication gives her horrible migraines. But it's good to know. And so we're just, you know, she's doing general Yoga 1, back lengthening stuff. You know, told her to work with her feet, stretch out her toes, all of those kinds of things that we've talked about with feet for sure, so that she mitigates any movement of the toes by continually stretching them and spreading them. You know, obviously you're not going to load her feet. You know, if somebody comes in like Ronnie has rheumatoid arthritis in her toes, so she can't stand on her toes. And now I think it's in her spine, so she has to be a little bit careful. But could she do hamstring stretching with a chair? Sure. I mean, you can do, the beauty of Iyengar yoga, again, because that's really the tradition with the props, is that you can have almost any condition and do Iyengar yoga because you'll be supported by the props, right? So as long as you do the right one. Ankylosing spondylitis, bamboo spine, which I didn't, I'm just going to give you a link to because I've only had it come in my personal classes twice in my life. Sorry?
Hyperketosis, yeah.
Sorry?
Hyperketosis.
Yeah, sometimes it's there, but sometimes it's, you know, it's just the whole spine.
I have a question.
It's rare that you'll get somebody that has bamboo spine. Bamboo spine is basically a condition where your whole spine stiffens up. I mean, all the ligaments start to ossify, everything starts to stiffen up until you can't rotate, you can't bend at all. And it's very rare. And so if somebody comes to a class with that, maybe to Ultra Gentle, great, you're here. What can you move? You know, that's just the whole thing. Can you bring? And the hard part is that often it affects the ability to breathe, because now all of these connections don't move very well. You don't really realize how much your back moves when you breathe. And if that back doesn't have any pliability anymore, it's very difficult to take a deep breath, right? So you do what you can. If they can't get their arms up past here, this is where it is, you know, it's just,
What causes that?
it's a disease. I mean, it's something that can be congenital, it can be a gene mutation, you know. But, you know, you wouldn't, there's a physician in town who has it. You know, he's very popular, he's been around a long time, and nobody even knows he has it. So there you go. I'm not gonna say who it is, because why? So, you know, you can still do your do with it, but it's a little bit tricky with yoga. All right, so let's go to the front of that page. We've got osteopenia, osteoporosis. So osteopenia is the beginning of osteoporosis, and thank goodness they start doing bone scans and bone density tests on women so that you can discover that you're heading in the direction of osteopenia, osteoporosis, which primarily affects it does affect some men, but it's mostly white and Asian women, not as common in African American or Latin American women, although they can certainly get it. There's lots of reasons. It could be congenital, it could be that you don't exercise, it could be you have deficient vitamin D calcium, it could be that your parathyroids aren't metabolizing calcium in your blood, it could be that that you drink too much alcohol or diet soda, this woman came one time, she had horrible osteoporosis. And she told me that for like all of her career, in her office career, which I'm going to make up, maybe it was 20 years, 25 years, I don't know, she drank 12 diet sodas a day. She literally leached her bones, all the calcium out of her bones, and didn't realize till her bones were fracturing that she had osteoporosis. Because she didn't do anything. She sat at the computer all day, right? So, God bless her, she was here. And what that leaves people like that is a life where they just can't do very much. You know, where they can still live. They
So
just,
the bones become brittle?
yeah, they
Yeah,
become brittle.
most of
Yeah,
them.
so all of the density, they become porous, and that porosity makes them brittle. Yeah, and the thing is that when you probably know more about this than I do, Anthony. That the medications for osteoporosis sometimes make the bones even more brittle. They're harder, but they're brittle.
It's, what they think is, yeah, they become harder. It's like putting plaster on it. You can't, there's a constant remodeling process that goes on with the bone as we use it. And the osteophytes and osteoblasts and osteocytes, they constantly shift things around, move calcium in and out, you know, replace things if you use your bone. But as you put stuff on top of it and layer after layer of this stuff, nothing happens underneath.
Right, right.
And then it kind of just starts to crumble, even though you fixed your roof.
So it's like a cast that doesn't have anything inside it.
Yeah.
Yeah, yeah. So I mean, it for sure. There's a discussion that goes on around once you kind of discover you might have the beginnings of osteopenia. Should you go on bone drugs? And you know, we're certainly not going to tell anybody what to do, but I would suggest if somebody says, you know, what do you think? Or my doctor says I should go on blah, blah, blah. I'd say, well, I would do some research and really look at what the pros and cons are. Look at what the most recent research is without offering an opinion, because you really don't want to get in that discussion, right? So the big worry with osteoporosis, osteopenia, is that if you move the body or you excessively force the bones, you could fracture them. You could cause a compression fracture, right? And I remember when I first started teaching people with osteoporosis, I was like so conservative. I was like, oh my God, don't even bend forward at all. And then, you know, like I have lots of people that have osteoporosis. And sure, we're not going to do anything stupid, but, you know, they can do a little more than you think. So don't panic. You know, again, it depends on the degree.